Hey, welcome back to Teaching Tuesday. I want to tell you about something really cool, which is sort of the history of plastic surgery and the difference between reconstructive and cosmetic plastic surgery and why it's like that. Okay, people have been trying to fix parts of the body for a long time, right? But if you go back to the 1500s, Gaspare Tagliacozzi figures out a way, this is a famous image from the history of plastic surgery, how to take part of an arm and make the tip of a nose out of it. Okay, it's called the Italian method. Indians had done it in India a long time ago also. He eventually says in a book, we restore, rebuild, and make whole those parts which nature hath given, but which fortune has taken away, not so much to delight the eye, but to buoy up the spirit and help the mind of the afflicted. That was a long time ago. As reconstruction continued, plastic surgery advanced in multiple different fronts. There's a lot of different things that we train in, right? General reconstruction, we in training would make new esophaguses out of the intestines, would take muscles and cover an exposed brain, make maybe take ribs to make a covering of brain and muscle, and so you can have skin over it. All kinds of great stuff. Microsurgery, because you're hooking up blood vessels from one part of the body to another. And then some of those techniques are used for breast reconstruction, taking tissue and reconstructing by attaching tissue from one part of the body to the other and getting blood flow hooked up through vessels under a microscope. And then we're doing small procedures, right? So we get good at things like hand surgery or small pediatric plastic surgery, famous cleft lips and palates, right? Life changers. Or even craniofacial surgery for kids who are born with skulls that don't grow in a normal way and can even compress their brains. And certainly facial trauma, car accidents or gunshots to the wound. World War I, trench warfare, people are not dying, but they're getting their faces shot. And so someone had to come up with ways to fix facial trauma, right? There weren't car accidents because there weren't cars, so there weren't high-speed traumas, high-energy traumas. So we learn a lot of techniques, ways to look at problems. And in research, always trying to find ways to solve problems no one's done before. Plastic surgeons tend to be on the forefront of research. The first transplant was a kidney transplant done by a plastic surgeon. Things that you hear about all the time, stem cell research, that was plastic surgery, right? And now in transplants, the cutting edge stuff, transplants, hands, faces, that's all based on plastic surgery research, trying to figure out how you deal with the immune system. So it's always on the cutting edge, which is why I got into it. It's like, I love the way these people think. But look, all those techniques that we learn, not so much that it might delight the eye, but buoy up the spirit and help the mind of the afflicted. That same concept, these techniques we learn, are used in cosmetic surgery. And that's why sometimes I'll say, some days I feel like Santa Claus. Sometimes it's like being a surgical psychiatrist. Because it's not so much that we're doing what we do so that someone has a better looking neck. It's so they feel better about themselves. So it kind of all goes together. We learn the techniques and apply them in so many different ways. And that's a huge mouthful. And that's plastic surgery.